Imagine losing 120 pounds in a year. The compliments roll in, strangers ask what your secret is, old clothes don't fit anymore, and for the first time in years, you catch yourself smiling in photos. That's the story social media loves to tell about Ozempic. What it doesn't show is the woman standing in her doctor's office 2 months later, hearing the word osteoporosis for the first time, and realizing her bones paid a price nobody warned her about. This is the side of the GLP-1 trend that doesn't make it into the before and afters. Not because it's rare, but because it's quiet.
What Ozempic actually is. Here's what a lot of people don't realize. Ozempic wasn't built for weight loss at all. It was cleared by the FDA as a type 2 diabetes medication designed to help regulate blood sugar. Its cousin, Wegovy, carries the same active ingredient, Semaglutide, but at a higher dose specifically approved for weight management. Both belong to a class of drugs called GLP-1 receptor agonists, medications that mimic a hormone your gut already makes naturally after eating. That hormone tells your brain you're full, slows down digestion, and quiets the part of your mind that keeps thinking about the next meal. For someone dealing with constant hunger, insulin resistance, or PCOS, that can feel like relief they've never experienced before. One injection a week, and suddenly food isn't running the show anymore. That's the appeal. That's why millions of people started asking their doctors for it, even people who were never diabetic to begin with. But convenience isn't the same as consequence-free, and that's where the story gets more complicated. The bones you don't see. Picture spending a year doing everything right, following the dosage, watching the number on the scale drop the way you always dreamed it would. Then a routine checkup delivers news you never saw coming: significant bone loss, osteoporosis, osteopenia. Not because anything was done wrong, but because when the body loses weight this fast, it isn't always just fat that disappears. It's not a failure of willpower, and it's not something that shows up on the outside. It's happening quietly, underneath a body that looks, to everyone else, like a success story. The muscle nobody warns you about. Here's something worth sitting with. The weight that comes off on a GLP-1 isn't only fat. Research has shown users can lose significantly more muscle mass than people who lose weight through diet alone. And muscle isn't just about how toned someone looks. It's what holds bones together, what keeps metabolism running, what carries a person into their 60s and 70s without frailty. Some doctors are already calling this the quiet mechanism behind a whole new wave of accelerated aging. It's not that the drug is doing something sinister, it's that it's a starvation-style weight loss, and starvation doesn't ask the body which tissue to take from first. When the gut fights back, imagine heartburn that starts small enough to shrug off. Tums a few times a day, nothing serious. Except it doesn't stop. One woman's mild heartburn turned into 2 emergency room visits in a single day, a gallbladder infection, and an emergency surgery, all traced back to a medication she'd already tapered off months earlier. Somewhere in the middle of that same ordeal, doctors also found a tumor on her kidney. It's not that every symptom is caused by the drug, but it is a reminder that just heartburn is sometimes the body's way of asking for help long before anyone's listening. The return of food noise. Here's the part almost nobody prepares you for. What happens after? For many people, GLP-1s don't just shrink appetite. They quiet something people call food noise, the constant background hum of thinking about the next meal. And when that noise disappears, life feels different, calmer. Then the medication stops, whether by choice, cost, or insurance, and the noise doesn't just come back. People describe it like something switching back on in their brain and screaming, "Eat everything." It's not that the drug failed. It's that most people were never given the tools to keep the results without it. The weight comes back because the habits that would have sustained it were never built in the first place. Not laziness, just an ending nobody explained. The flatness. Some of the quietest side effects don't show up on any lab test. Doctors treating patients long-term are starting to describe something they call flatness,
Not sadness, exactly. Just a dimming. Less drive to leave the house. Less pull toward the things that used to feel exciting. It makes a strange kind of sense once you understand these drugs don't only affect appetite. They act on the brain's dopamine and reward pathways too. That's part of why cravings for food, and sometimes alcohol, fade alongside hunger. But reward systems don't discriminate. When you turn down the volume on craving, you can turn down the volume on joy right along with it.
The hair in the shower drain.
Imagine losing weight exactly the way you hoped, and then noticing your hair coming out in clumps in the shower. It's one of the most common stories buried under the success stories. Rapid weight loss pulling nutrients away from hair follicles because the body suddenly isn't getting enough protein, enough calories, enough of what it needs to keep every system running at once. It's not vanity to grieve that. Hair is tied to identity, to feeling like yourself. And for a lot of people, watching it thin out is the first real sign that something underneath the transformation isn't being taken care of.
What the lawsuits are saying. There are now thousands of lawsuits moving forward against GLP-1 manufacturers, and a judge has already allowed most of them to proceed. The claims center on things patients say they were never fully warned about. Stomach paralysis so severe it requires hospitalization, bowel blockages needing emergency surgery, a heightened risk of a rare form of vision loss, pancreatitis, gallbladder disease, kidney damage. Nearly 500 deaths have been reported to the FDA. Right for some people. It means the full picture is bigger than a before and after photo can hold.
None of this is about shaming anyone who's on these medications or scaring anyone who's considering it. For a lot of people, GLP-1s are genuinely life-changing, lowering blood sugar, easing PCOS, quieting a relationship with food that felt unmanageable for years. That's real, and it deserves respect. But so does the other side. The bone scans nobody posts, the hair in the drain, the flatness that shows up after the compliments stop, the rebound that happens when the tool disappears, but the missing habits never got built. Real informed choice means knowing both sides before you start, not learning the hard way after. If this gave you a fuller picture than the transformation videos usually do, that's the point. Subscribe if you want more of these honest, unfiltered looks, because the full story is always worth more than the highlight reel.